Hey guys, Dr. Rick here from Tailored Teeth. I have a fantastic video for you today. It's about Bruxism, aka stressed people disease. Now, I'm sure you feel it. You have stress from your work environment. You have stress from the expectations of people relying on you or people around you. You have stress from perhaps poor posture. You have stress from your screen time and phone use and notifications. When I went through uni about 10 years ago, Bruxism as a disease was only experienced by about 20% of people. I'd say that in my demographic, in my clinical practice in Sydney, 80% is closer to the mark. Almost everyone nowadays, due to the changes in our lifestyle over the last 5 or 10 years especially, has been grinding and clenching and posturing and holding so much tension in their face. I want to give you guys a working definition of Bruxism. Bruxism is when environmental stress turns into psychological stress, which gradually accumulates until, and everyone has a limit, you reach that limit, and then it bubbles out into physiological symptoms. And generally, that's tension or holding particular muscles tight. And it's how your brain literally kind of moves things out of that psychological space so you remain functional. How it does that is clenching, grinding, holding tension in your face, masseter, generally increasing the tone in that lower half of your face. This is Jeffrey. Jeffrey has very kindly volunteered to demonstrate how this tension actually builds up. So it starts off with the masseter, which is the main muscle responsible for your clenching and chewing force. The masseter muscle will increase its tension and actually hypertrophy, get thicker and stronger until the amount of force that you can actually exert on your teeth gets really high and we start damaging the teeth themselves. The next muscle that gets the tension after the masseter is the temporalis, which is just on the inside here and goes up to the side of your head there. This is the one that's responsible for tension headaches, and it can actually extend that tension into neck pain, making existing neck issues worse, but sometimes actually causing it in the first place. The other smaller muscles that are implicated in Bruxism are your lateral and medial pterygoid, which you can see on the inside here. And when the tension accumulates in these muscles, we'll end up with TMD, or temporomandibular joint dysfunction, which effectively means this joint, which should be rotating and translating, will actually start to dislocate. You don't want it to get to there. A little bit more about the consequences of not doing anything about bruxism and stress. The masseter muscle, we talked about cracked teeth. Cracked teeth will obviously be more sensitive and painful than healthy teeth, but another couple of things you probably haven't thought of is that the cracks are perfect for bacteria to just wheedle into like that and start causing decay inside the tooth. There's very little you can do about it. Even if you have really good oral hygiene, the bacteria and the cracks are too fine and too small for you to be able to do anything. So you will end up needing more fillings than you would have otherwise. Also, some procedures, even cosmetic procedures like whitening, are contraindicated, so it's not suitable for patients with really severely cracked teeth to have whitening procedures done because the sensitivity can be absolutely unbearable. The TMD, dysfunction of the temporomandibular joint, can result in locking of the jaw joint, so when you are open like this and physically can't close, or closed and you physically can't open, if that joint comes out of the socket. You'll also get a little bit of clicking as the joint sort of moves out of place. Also, you can end up with muscle and pain in the joint itself, leading to tension and pain elsewhere in the mouth and head. Chronic pain and headaches that can happen from the temporalis, that fan-shaped muscle up there, can result in tension headaches throughout the entire scalp. All of these can be avoided. I want to just give you some tips on how to identify, maybe even self-diagnose, so that you can take some steps into preventing some of the more serious consequences of bruxism. Now, unfortunately, self-diagnosis with this particular disease can be incredibly difficult because the same process that actually puts the tension in there will mask its existence. So you have anxiety and tension, and that's building up in the lower half of your face, and that causes more anxiety itself, meaning that you want to push down these symptoms. The implication of that is that inevitably, for you to start addressing this, it's going to get worse as you bring these symptoms to your attention before it can start getting better. Another thing that you can check for is the presence of something called a linea alba. That's Latin for white line, and you can see it on the inside of the cheek, and it actually is a thickening of the lining of the cheek because of that friction that's constantly being caused by the clenching and the grinding of the teeth on the cheek itself. One thing that you can do at home is the trigger point in between the masseter and the temporalis is just here. So you feel for the bone, this is called the zygomatic arch, and you'll just press in there. You move your finger while you're pressing quite hard back and forward in an arc just underneath that bone. And you may notice that the pain radiates backwards towards your ear, or maybe inwards towards your joint, or upwards towards your temple, and that can be an indication that there is a lot of tension that's being held in that lower half of the face. Another thing that you can check is if you just put your fingers over the masseter muscle, which is just on the side here, a bit lower than the trigger point, and clench, how much does the masseter muscle actually move? If it's moving quite a lot, like a bicep muscle that you're just trying to flex, then that's a concern. These muscles should not be able to clench and tense that far. Another few ways that you can pick it up is if you have tension in the sides of your face or up the top here when you wake up in the morning. You may feel that these muscles on the side here, when you're eating chewy or hard food, start to actually get fatigued, like DOMs after you've had a really intense training session. Another sign may be tension and headaches in the side of the head and the top of the head and the scalp. Now, say you've gone through this self-diagnosis process and you have identified that you might have a problem with bruxism. What is there to do? The first step is official diagnosis by a doctor, and to have them guide you as to how to gain some awareness for this process, because without addressing the root cause, which is your stress management, it's just going to keep going. That might be okay. Say you're just in the middle of an insane project at work, you know it's going to end, but you can feel this damage occurring. Talk to a doctor about it. There may be something that we can do just as a band-aid solution for the period of time that you are really stressed and damaging your health, before it actually becomes a permanent degeneration of that part of your body, be it the joint or the muscle or the amount of tension or your stress management. We have an entire protocol, I call it the Bruxism protocol, which just defines effectively how to live a lifestyle that is not chronically stressing you. And it's little things like how you interact with your phone, how you control your sleep hygiene, how you manage stress, little tips for the end and the start of your day, just to make each day a bit more productive and a bit less stress-inducing. One treatment that has been very successful for me in my patients who are suffering with chronic pain from TMD and from bruxism is muscle relaxant injections strategically. And again, get it done by a doctor who knows what the anatomy is and isn't just putting Botox wherever they think they should put Botox. We start with the masseter muscle. There might be some compensation by the temporalis, like we've shown you. And just managing that very closely can have very, very good effect on patients, especially if you're currently in a lot of pain from this disease. Lastly, and one of my favorite things at the moment is splint therapy. You know that you cannot be damaging your teeth anymore. You know that the ligaments and the cracks and all of those things will not be progressing. And if it's done really well and monitored really closely, it will actually relax the temporalis and the masseter muscle. I know it's a lot of information, guys, and thank you so much for making it this far through the video. If you have any questions or concerns, please let me know. And if you think that this video may benefit anyone you know, please share it with them. Thank you so much, and keep smiling.